Neil McCabe, senior reporter at Human Events. Neil, we appreciate your time and your presence here today on America's Forum.
Great to be with you, JD.
Neil, can you take us back and unpack this story? Because reading your article in Human Events, it sounds like this is a classic case of a program designed to help the poor, in essence, being hijacked through loopholes and technicalities.
Yeah, it absolutely is a hijack. You know, what happened in 1992, there was a bill that went through Congress. It was the major bill, the major point of the bill was to help veterans' health services and to improve the care of those who had served in the military. And part of that was slipped in a section that would basically allow federally recognized clinics or hospitals that are in poor neighborhoods to buy cheap drugs and then full boat the insurance companies of their patients. And this was, so it wasn't a direct subsidy, but it was meant as a subsidy for these hospitals and clinics that were serving poor communities. And so the intention, of course, was to avoid direct payments to these clinics and hospitals, at the same time helping them out. Of course, part of this program was that uninsured patients were supposed to also get the reduced price that the hospitals and clinics were getting. And these discounts are running anywhere from 25 to 40%. Of course, you can imagine that these clinics and hospitals have done nothing but collect the profits. There's no evidence that any hospital has made any effort to give the uninsured these discounts. And then when Obama came in with Obamacare, Health and Human Services, at his direction, expanded the program. So they're going to go from about 14,000 facilities that participate to 20,000 facilities. And they also allowed the hospitals to partner with drugstores so that CVS, Walmart, Walgreens, Rite Aid, these national drugstore chains can now get that discount from the hospital. So typically what would happen is, you go to the hospital, they give you a prescription, you go to the hospital pharmacy, and then there's sort of a one-time purchase. And then after that, you go to your local drugstore. Well, now the hospitals will be able to participate in the ongoing prescription buys, and the drugstores will be able to participate in the discounts, because now these hospitals and clinics have become wholesalers outside their four walls.
So this has, we talked about a hijack earlier, but
Yeah.
Neil, as you explained this, I've got a new name for it. It sounds like a scam, where at different levels of this, different commercial entities, different healthcare providers are basically able to inflate prices. And of course, the loophole was expanded through Obamacare. Now, Neil, this stands in stark contrast to what the president told us on the campaign trail when he was Senator Obama, that lobbyists would have no influence with his administration, that everything would be transparent. How about the transparency of this? Did you have to drill down? I know my old colleague in Congress, Joe Pitts, Republican of Pennsylvania, chairs an Energy and Commerce subcommittee that has been looking at some of this. But how clever was the expansion of this loophole in terms of keeping it quiet for the general public, and the very lack of the transparency that candidate Obama promised?
Well, I don't know if candidate Obama has any relationship to President Obama. I mean, the only time I see reality between before and after is when he accidentally told the truth when he didn't think people were listening, like when he talked about people clinging to their guns and religion. But, you're right. Congressman Joe Pitts has been a champion on this. But, it's been very difficult to get information out of HHS. And so Congress has had to rely on sort of IG reports, government accounting office reports. But because of the way the law is written, the drug companies actually do not have to disclose their discounts to the hospitals and clinics. And so this is called proprietary information. So there's no real way of gauging, what the drug discounts are on each particular drug. There are estimates that this is going to be a $12 billion market in 2016. So if you figure that at the discount of 30%, that people are clearing $300 million in profit off, $3 billion in profit off of this.
Neil, as you've outlined this, and you talk about the major retail pharmacies, have they had the need to comment on this publicly? Because, at the rollout of Obamacare, or even the prescription drug coverage as Medicare Part D, when I was in the Congress, we saw efforts made to make sure that generic drugs were available at a cut rate price, and we heard from a lot of the retail pharmacy chains. Are they saying anything about this provision?
Well, I'll tell you right now, it's very difficult to walk through the halls of Congress without tripping over a lobbyist from these drugstore companies. I mean, they are everywhere. And if any of your listeners or watchers just sort of do a Google, the program is called the 340B program. And so if you were to Google 340B plus jobs, you will see that Walgreens, CVS, Walmart Pharmacy, they are all hiring analysts and executives and accountants and clerks to staff up their programs. This is a multi-billion-dollar program, and it's growing like gangbusters, and they're working like heck to keep this piggy bank for themselves.
Wow. So this reminds me of my days on the Ways and Means Committee when you would see different Washington tax attorneys basically devote their entire careers to one section or perhaps one subsection of the tax code for the industries they represent. This sounds like a variation on that theme now with the burgeoning regulation of healthcare and this almost prefabricated loophole that has been enlarged over Obamacare. So, Neil McCabe, what is the takeaway for us? Will we see legislation drafted by Joe Pitts to try and stop this? Are the drug companies and hospitals who appear to be operating now as de facto drug wholesalers, or at least the clinics and hospitals are they arguing that there's actually an advantage to the 340D program? What's happening with this that we can take away from it?
Well, it's very difficult to attack a program that's designed for the poor, that is part of legislation that's titled, for the benefit of veterans' health. And so you understand, JD, more than anyone, how this game is played. But I think where Pitts is really has his hook into the abuse is the fact that these hospitals and clinics had a moral obligation to pass on the discounted prices to the uninsured, and they had a moral obligation to take the profits from this program and to turn that over into greater spending for the community and sort of their mission of helping the poor. And I think that's where he's zeroing in, and that's where he's going to sort of go for some reform. I don't think that Congressman Pitts wants to destroy the program. I think Congressman Pitts wants the program to be more faithful to its intent, which was to help the clinics and the hospitals that are in these distressed areas. I don't think anyone's against that. And to pass on these savings to the uninsured, because there still are, in this world of Obamacare, believe it or not, we do not have universal health care insurance coverage. And so that's even more of a problem than it was before Obama became president.
Neil McCabe, senior reporter at Human Events. We thank you for the story that appeared in your publication, and we thank you for this in-depth explanation with your time this afternoon on America's Forum.
Great to be with you, JD.
Neil McCabe with a story that brings to mind a bit of bumper sticker wisdom. Perhaps you remember it. During the whole battle of Obamacare, the sticker read something like this: "If you think health care is expensive now, just wait until it's free." And what Neil McCabe offers there, an object lesson in how the atmospherics, the perception, the original mission of a piece of legislation has in essence been hijacked for purposes of profit, if not for purposes of fun. Now, we'd welcome your comments on this story and on others we've covered today. You can tweet us your comments at Newsmax TV, hashtag America's Forum. There's also email. Our address, connect@newsmaxtv.com, and Facebook, it's facebook.com/Newsmax. Now, when we come back, a Russian rocket fails to take off while Russian President Putin plays hockey. That and more coming up.